Hi, I'm Kelly. I'm with Occupational Therapy.
Hello.
What's your name and date of birth?
Luva 11/16/66.
Hi, Luva.
Hello.
I see that you came in for another treatment. How's your
Yeah.
week been?
It's been okay.
Have you had any pain?
Yeah, I have had a little bit of pain.
Where's your pain been?
It's been right here.
Okay. Look at it. Doesn't seem too swollen right now. The first thing we're going to do today is test sensation, and that's like the feeling in your hand, okay?
Okay.
And we want to do that just to make sure that some of the inflammation isn't putting pressure on that nerve and causing you to lose sensation. Have you had any tingling or numbness at all?
No.
Okay. So I'm going to make you more comfortable.
Okay.
Let me set this up. Let me put a towel over this. We're going to make sure this is all the way down. There we go. Let's take your arm and lay it real flat. I want you, that does not look comfortable. Let me make you more comfortable. Okay, let's lay your fingers all the way flat there. Are you comfortable?
Yes.
Okay. So during this test, all I use are these are kind of like a fishing line. If you want to give me your other hand, this is all it is.
Okay.
It does not hurt. It's not an invasive test. So I'm going to have you close your eyes, and when you feel the touch, I want you to say touch. Okay?
Okay.
And so it's just going to be a real gentle touch, just like that.
Okay.
Okay? Close your eyes.
Touch. 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 Touch.
Okay. Same thing. Just keep your eyes closed and tell me when you feel the touch.
Okay. Touch. 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 Touch.
Okay. That's all for that
Okay.
test. So since you said that you've had some pain, when is your pain the worst?
When it's about an 8 out of 10.
What time of day is it about an 8 out of 10?
At night.
At night. Okay. Is it after you've had a lot of activity?
Yes.
Yes. Okay. What about first thing in the morning? How does it feel in the morning? Is it loose, easy to move? Is it feeling tight?
Tight.
It feels tight. Okay. I would like to possibly use some ultrasound. Ultrasound, it's a deep heat, and so it'll help with that tissue. So it'll loosen it up so that you can do your stretches more easily, and we can do those exercises I gave you. And then it also helps with pain.
Okay.
But there's a few questions I need to ask you first to make sure that it's safe. The doctor gave us an order for it, but I just like to double check before we start. Do you have a pacemaker?
No.
Have you had cancer?
No.
Has the doctor said anything about a blood clot or poor circulation in your hand or anything at all?
No.
And your hand doesn't look very swollen right now. So sometimes after you've had a fracture, it if you do the deep intensity, you'll feel some pain. I'm going to do a lower intensity today. So we can try it, but if you feel any pain at all, just let me know. The worst part is the gel's a little cold. Okay. The head of it is heated, okay, and so that should offset that. Let me get my ultrasound machine going.
Okay.
So how has it been this week with cooking? I know you love to cook. Are you able to lift the pots and pans yet?
No.
How about, let's see, let me think. Our last session, you said you had a little bit of trouble with, sorry, I need to negotiate this through here. The last session, you said you had a little bit of trouble with fixing your hair in the morning.
Yes, I'm still having those.
So because problems. You're not able to bend your wrist back very much so far. Okay, let me see. I'm going to, let me move my camera a little bit. There we go. Sorry.
It's okay.
Okay, so let me turn on our machine. So hopefully we can do a few things here that will help loosen that up some and help you get some movement in there so we can get some more of the things you love to do.
Yes. I really do enjoy like doing my hair and things like that. Mm-hmm. So not being able to really do that like I did or be able to cook my own meals like I used to is kind of difficult.
You were telling me about baking.
Yes.
What's your favorite thing to bake?
I love to bake different types of bread, like banana nut bread. It's my favorite.
Oh, yum. I love banana nut bread.
Yeah, I really enjoy doing that. And so I'm hoping that I can get back to doing that soon.
I hope so too. Let this head warm up a little bit. Okay. There it goes. Ultrasound, 1 megahertz. Okay. There it goes. Okay. All right, it's going to be a little bit cold at first, okay? Are you ready?
Yes. How long does this typically take?
So today we're going to do 7 minutes. Okay. So typically we'll do anywhere from 5 to 7 minutes, and we'll do this before we start your stretching and your exercises. So hopefully that will help you have some more stretchability in your soft tissues here. Okay. So all this that tends to get tight. The other thing I'm going to look at for you today is we're going to make a splint for you. I know you just got out of that cast splint, but this one I want you to just wear at night because we don't want to limit you being able to move your wrist during the day, okay?
Okay.
It's important for you to move it, but I think you're getting your exercises done every day, and then at night we're not protecting that wrist, and we need to protect it so it can still heal. So we need to protect it, but keep it in that optimal position. I think what's happening is you're using it all day, and then you go to sleep and you might roll over on it. You're getting some swelling, and we're not holding it in that perfect. What we call this splint is a wrist cock up splint. So it kind of cocks your wrist up to keep it in the optimal position so that the fluid can drain out so you don't get that swelling. And it also keeps these soft tissues we work so hard on nice and loose so that you don't have that tightening overnight.
Okay.
And if we're taking all that down, hopefully that's going to help you start sleeping better.
Yes.
help that pain come down, and then you'll be able to work more on your strengthening that we've been talking about.
Okay.
And if you're strengthening, then what's going to happen? You can get back to
my cooking. I'm doing here and making that good old bread.
That's right. So what do you think is the hardest thing about baking right now?
Well, with being that my arm is in this situation, when I go to use my whisk just to kind of stir.
Oh,
yeah. So that has been kind of difficult because it's like a constant movement that I have to kind of twist my wrist and my hand. And I kind of get tired really quick, and it's painful trying to do that.
So one thing you could do right now is start maybe with this wrist, but if it gets tired, take a break and let this hand hold your bowl still.
Okay.
And then use your other one to whisk. But that's a great exercise. Do something you love, right? And then you're practicing those motions, but just don't overwork it. If you start seeing some swelling, anything like that. How's this?
This is okay.
You haven't had any pain or anything?
No pain.
Perfect. Hopefully, this is going to help you.
How long have you been doing this?
I have been working in the field of occupational therapy for 10 years, but I just recently went back and started my master's program. So,
cool.
Right now I'm a student of occupational therapy, but I love what I do. I love getting to know people. Yeah. I love hearing about baking and seeing how I can help you.
Yeah, okay.
So has your husband been helping you with your hair?
Well, he tries, but
how does that go?
He's not that good at it.
He's not that good. Oh, well, at least he's trying.
Yeah, he's trying.
All right. And our time is almost up.
Okay.
Now, when I did your sensation test, it was all normal. There was one spot that wasn't real consistent, but it's right there where I would expect.
Okay.
So it's what we call the median nerve coming right up through here. And I just think maybe if you had some swelling, it could be pushing on that nerve a little bit.
Okay.
So if you feel any tingling or something, be sure to let me know. I'm going to test your sensation again next week after we've been using the splint for a week and see if maybe that was the cause. And now that we're positioning it well at night, if it's not helping reduce that swelling, and then you're back to normal sensation. It just showed that your lightest touch wasn't a little bit of discrepancy, a little bit diminished is what they would call it. Okay. Not as good as it normally would be.
Okay.
Right? All right. And there's our timer.
Okay.
All right. Let me put this up. And then I will clean up your arm and we'll move on to the splint, okay?
Okay.
Okay. I'm just going to use this towel. Get this goop off. Did I get it all?
Yes.
Awesome. Move this out of the way. Okay. Let me take this towel off because it's got the goop on it.
Okay.
I'm sorry, Luba. Oh my goodness. You have a klutzy therapist. I'm just telling you. I forgot to tell you that at the beginning of this session. Oh, I'm telling you. Sometimes I think there's just imaginary holes on the ground because I just saw. Okay. So this is your splint. And how you wear it, I'm going to show you, and then I'm going to have you show me how to put it on, okay?
Okay.
So don't be afraid to move your wrist. It's okay. That's how we get more motion, right, as we
Okay.
practice. So you're going to make sure that this joint comes all the way through, okay?
Okay.
And I'm probably going to go back and add a little bit of cushion right here for you because I see that it could be a problem rubbing, irritating your skin. And then you're going to put these straps on. Okay. This one's a little long, so I would come in here and fix that. So when you're putting your straps on, I want you to be able to put a finger underneath. You don't want them super tight, okay? This is not strap it on and make your hand purple and blue.
Okay.
So things I need you to know is heat will distort this. So don't put it near an oven. Don't leave it in the dash of your car. Like you're running late in the morning and you just, I still have on my splint and throw it. Don't leave it because the sun will melt it.
Okay.
Okay. Don't leave it down. A dog, for some reason, animals love to chew these things up. If you have any pain, any, like say you take it off, I'm going to take it off and look at your skin here in just a minute. Say you take it off and you have some redness somewhere, I want you to let me know where that is and don't let me add some things in there that'll keep you. Okay. I can adjust it so that it doesn't get you. You want to make sure that, see your little bones right here? You want to make sure those line up right there. Okay. And that wrist. And then this strap goes over that. This goes over your forearm, and this goes right across the back of your hand. And then if you have any numbness or tingling, you know what I'm talking about? Mm-hmm. Okay, tell me that too. Okay. So those are the things we need to watch for. If you sweat in the night and things are kind of icky, you can use like Dawn dish soap or like a mild soap and clean it, and you can clean the straps the same way. Just make sure that they get good and dry before you put it on the next night because it could irritate your skin. Okay. Right. Okay. So I want you to try and take it off and put it back on for me so I can make sure that you know how to do it by yourself because I'm not going home with you. Okay. I know we like each other, but I'm not going home with you.
Okay. So it's off.
Good.
Okay. So I put my thumb through here.
Uh-huh. Where's your wrist supposed to go? Is it lined up?
Yes.
Yes. Okay.
And I strap it in, not too tight.
How much space should you have?
2 fingers?
1 finger.
1 finger. Mm-hmm. Okay.
Great. That might be, we can move this over a little bit.
Okay.
That'll help.
There we go.
All right.
1 finger. Okay.
Nice. You did a good job. Now let's check your hand real quick for any irritation on your skin and make sure we don't have any.
Okay.
Okay. I don't see anything. Do you have any pain anywhere? Do you feel anything?
No, no pain.
This is where I would worry about. These are the spots I would really watch is right there because that's what we call a bony prominence.
Okay.
Okay. Anywhere your bones kind of stick out or you have a joint is where you're going to worry about. But this is going to keep that, see how it's kind of hard?
Yes.
That's going to keep that wrist in that optimal position because if it's up like this, see how it's so much easier for that fluid to flow out? Yeah. So I'll see you back at your next appointment and we'll see how this is working. And I'm going to test your sensation again then and see if that's what's going on there.
Okay, great.
Thank you so much.